Hi, everyone. This is Towan Isom, and welcome to All Americanish. In this episode, we're going to be discussing something that I think a lot of people hear all the time, but they don't really know fully what it entails. I know I don't, and I have a ton of friends who are physicians and work in the medical industry, some who have started long term care businesses, and they are a little bit concerned about everything that's going on now as it relates to Medicaid and Medicare. And so oftentimes what I find is we don't have a source to go to when these things come up. We know at All Americanish we don't pick sides, we don't pick Republican, or Democrat, but what we do is we focus on the impact on the people. The reason why we don't do that is because it's a distraction. It becomes, people just automatically, when you characterize what your side is, even though most of us bend one way or the other, you automatically, I find, people automatically tune off listening and they miss the whole point of the conversation. But we don't do that here. So we just take what we are and put it to the side, no labels. But what we focus on are experts, people who are doing this work every day, people who are committed to seeing change, and they are called, burdened, purpose to really bring an impact to the people. Whether or not we agree how they do it, I think it's important just in our own development to really focus on the information and draw our own conclusions. So I will say that I'm excited about this conversation personally because there's a lot going on as it relates to Medicare and Medicaid. I have no idea the impact on this big, beautiful bill, but I have someone who does. Her name is Kim. She's a new friend of mine. Kim's going to tell you all about herself. But when I heard of all the work that she was doing, her expertise, I was like, we have to have her on the show, not only just once, but probably a Q&A session after this time as well, to kind of help us navigate what the Medicaid, Medicare bill impact would be from this big, beautiful bill. So please join me in welcoming my guest, new friend, knowledge expert on anything and most things when it comes to Medicaid and Medicare. Kim, how are you, Kim? I just go first name. How are you
Well,
doing?
I'm well. I'm actually you caught me on vacation this
Ah,
week, so I'm
you must be
taking a break
important.
before Congress is out on recess, so it's a good time for policy folks to take a break as well. So I'm down here at the beautiful. I can see the ocean from here. I'm in beautiful Duck, North Carolina, just for the rest of this week.
Awesome.
Yeah, so so for this week I'm doing well.
You said for this week, but we'll see how it goes when you go back on the hill, right?
Exactly. It's a little bit of a crazy time, but thank you so much for having me. And I totally agree with this that this should be nonpartisan. Disability is nonpartisan, and we're all impacted by disability in one way or another. And if we live long enough, we're likely to have one or more disabilities. And the ARC of the United States, where I work, is a nonprofit, and we are totally nonpartisan. We've been around for almost 75 years, and
Wow.
yeah, representing those with intellectual and developmental disabilities. And the strength of our organization is in our network. We have almost 600 state and local chapters across the country that are really doing the hard work and the meaningful work of caring for and advocating for people with all types of developmental and other disabilities.
So let's talk about that a little bit. Let's talk about you first. Can you give us a little bit of background about you? I know you are. When I see you, I think putting on a cape. That's what I think when I talk.
Thank you. I actually have been in the disability policy field at the federal level for almost 30 years. I know I look young, too young for that, but
Right,
I've
right.
been doing it since I was a
Oh
child.
no. And now I'm only 30, right?
Right. And I have several family members with developmental disabilities. For example, I have a brother in law with autism, intellectual,
Oh, wow.
and other developmental disabilities, and he is minimally verbal. So really only speaks when you're spoken to, and has very few words. Um, but he's a wonderful, wonderful man. And when his mother died, my partner and I had to drive to Upper New York State to get him, and we brought him into our homes, which meant we had to change states, and which means we had to start all
Really?
over. In terms of getting services, it's very difficult. We brought him to Maryland, and so he was getting services in New York State, but then when you move, you're at the bottom of the waiting list.
What? Someone else
Yeah,
mentioned that. So how does that work? So you have to apply. So there are not enough practitioners. Like what does the state offer in support? Because I think
yeah,
people do think like lazy people on these programs, but let's just get right into it. What does the state offer
yeah.
families?
So Medicaid, first of all, is a federal and state partnership. So the federal government
Okay.
provides a certain percentage, and then the state has to match it. So it's anywhere from 50 to 90%. It depends on the wealth of the state. So some states get a bigger match, and some, yeah, yeah. So every state is different. And states have a lot of flexibility in terms of designing their Medicaid program. It's also even called different things in different states. So some people don't even know they're on Medicaid, because it's called different things. But anyway, so the state can develop their own Medicaid programs, and some offer a lot of services, because some of the
Hmm.
services there's mandatory services and there's optional services, and so they can develop their own programs. And some are very generous, and some are not so generous.
What
Um,
states typically have the best Medicare and Medicaid programs?
Well, I'm specifically talking about Medicaid. I'm not an expert in Medicare. That Medicare is mostly for older adults over
Right.
65, and Medicaid is more is for the so-called traditional population, are mostly children, pregnant women, people with disabilities, and low income, mostly low income, low amount of resources.
Yeah.
It's typically not that easy to get on Medicaid. Um, but then, with the Affordable Care Act passing and signed into law in 2010,
Which some
the
people refer to as Obamacare. That's a
some
whole
people
yeah.
refer to as Obamacare.
Mhm.
The Congress was trying to figure out, how are we? There's so many people that are uninsured. How can we most efficiently and effectively cover these 20 or so million people? And so I think they very wisely
Mhm.
chose to cover by allowing states to expand Medicaid to low income individuals, those up to 138% of poverty, which for a single person is about 22,000.
Uh,
Yeah.
I
And
can't even
so
believe that's a question,
I
honestly.
know, I know. It was such a game changer for
Yeah.
people with disabilities, because two, 2/3 of people with disabilities are on Medicaid, not through the traditional SSI, supplemental security income pathway. So Medicaid, a lot of people with disabilities were were covered. It was a game changer, because of expansion. But only 41 states took up the option to expand Medicaid. We still have states that have um, not taken up that expansion, but it was a game changer. So there's a lot of people with disabilities that are covered in this expansion population. They may have chronic illnesses, multiple disabilities, and still not get coverage through the traditional pathways that are rather difficult to get into. Some people have mental health issues, and there's a lot of older women in the expansion population that are probably mostly caregivers.
Wow.
Yeah.
So I'm just floored with that. So 41 states. So just because the monies are available, the state has
Yeah.
decided, the governor determines whether or not to access that funding for the
Yeah.
public.
At first, the Affordable Care Act mandated that states take up this
Right.
option, and then some states got together and sued because they didn't want to do the expansion.
Well, why would
And
they want to do it, the expansion, if it's going to help the
you
public?
know, I don't. It's beyond me why states would not want to cover their population and get 90% match with the expansion population. So why would they throw that money away, essentially, and then allow their citizens to be not covered by insurance? So those states that don't have the expansion, there's a large what they call coverage gap. And so states are still slowly coming on because they're some people really want the health insurance and they're putting them on referendums. Like North
What's the
Carolina is
referendum?
one. The voters put it on a put it,
Oh,
they put
gotcha.
together a referendum and tried to force their state to take it up.
Is it
So there's
working?
yeah, some states are North Carolina came on board. I think they're one of the most recent ones.
Wow.
Um,
So are
yeah.
most of the states that don't pick up, because I think a lot of people don't really know this. Like for me, I didn't know, and I'm pretty, knowledgeable Medicare, Medicaid, the fact that Medicaid does include disabled. I thought that was covered under Social Security. But the fact that,
Ah.
yeah, see, many Americans, and I can say this honestly, don't know
Mm-hmm.
what is
Yeah.
common knowledge. Like I assumed that everyone had to have I mean, not even that they had to, but they would choose to access federal funding for their constituents. So this would mean that if you are in whatever state, because I did a study, we did something on education, and I did a study on education and found out what states are supposed to be like, oh, so for pro education. And what I discovered was I was so surprised that the Democrats they paid their teachers more than some of the red states, right? So we're just dealing with facts. But it was really surprising to me that the oversight of the Department of Education, with the Department of Education being dismantled, just from a federal perspective, like people are losing opportunities to get federal resources, and to what end and to what benefit. So when you tell me this, I'm just really surprised that
Mm-hmm.
you can, for kids who may have autism and be on the spectrum, that there are federal funds available, but the state is opting not to access those funds for to help them.
Yeah.
That's
So many individuals with intellectual and developmental disabilities do get once they apply for and get SSI, then they're automatically eligible for Medicaid in most states. So that's why you might have thought that that they were getting healthcare through Social Security because of the attachment of Medicaid. But it's hard to get onto SSI. It's at this strict eligibility rules. That's why the expansion was such a game changer for people with disabilities who were not otherwise able to get on the traditional pathway.
Do you know off the top of your head, like just what states are not accessing the Affordable Care Funds?
Um, it's a lot of southern states. Um,
Well, and God
yeah,
knows they need it.
I know, I know, but no, I can't list it off of the top of my head.
I'll find out for our listeners what states are not accessing those funds.
Yeah.
Okay, so now that was the mandate. So now the mandate, when did the mandate go? Did that leave with President Obama? When did the
You
mandate
mean the
go?
mandate for the expansion
Yes.
population? Yeah. So soon after the Affordable Care Act was signed into law, states sued, and then the Supreme Court, I guess it was a couple of years after, maybe 2012, I can't remember. I remember where I was. I remember the Supreme Court decision coming down. I remember exactly where I was. But I think it was like 2 years later, so that would be 2012. The Supreme Court said that it would have to be an option that states could expand if they want to. And then so the 90% FMAP, or the federal matching rate, which is very generous, was to be an incentive to states to expand. And now they're turning it around and saying that it's unfair. But it was really for the federal government to help states cover their citizens.
Wow. And those were federal resources. So the money that they don't access, what goes to them? It just goes away, or the federal just reappropriates that somewhere else?
There's coverage gaps. There's people that are uninsured.
Wow.
Yeah, I just read a story. I just read a story today in the Washington Post about North Carolina. There was a story about a woman who most of her life wasn't insured, and the expansion was a game changer for her. And now she has cancer, and she's getting services.
Treatment.
She's getting treatment.
And now that's going to go away.
And now they're nervous. They're nervous about it because they just expanded. So the newly passed bill, the reconciliation bill, put a lot of emphasis. There's $1 trillion worth of cuts, first of all, in the HR 1 that was signed into law, and some people refer to it as the one big beautiful bill, but mainly it was a budget reconciliation bill that cut Medicaid by an historic 20% of the program, and a lot of it was focused on the expansion population, because ever since the Affordable Care Act was passed, Obamacare, there are a number of members of Congress that just never liked it. And
why didn't they like it, though? Did they have any reason why they didn't like it? I mean, other than the fact that it was just Obama. I mean, that's stupid. It's just
I mean, it's hard.
For people who just have common sense, like, what was the factual reason why they did not?
There was a lot of misunderstandings about it, and opponents just don't like federal funding for anything. They want to. There are some members of Congress who just feel like the federal government should be doing very few things, like providing military, of course. That's why they're trying to dismantle the Department of Education. They want everything to go back to the states except for very minimal things. And so they framed, there was a lot of misinformation and disinformation about the Affordable Care Act, just like there is about Medicaid now. They framed it as a government takeover. And I don't know if you remember that they said that there were death panels for older people.
Yeah.
That was none of it was true. I was shocked myself as a disability advocate. I knew how good it was going to be for people with disabilities, because it covers people with pre-existing conditions. It used to be so scary to be a person with a disability or have a child with a disability, because you're so afraid of it's hard to get insurance. And if you get insurance, you can't change jobs or move or anything, because you can't risk not being uninsured, because the next insurance company might not take you because the pre-existing conditions. So that was a game changer for people with disabilities, and also the preventative care at no cost or low cost. That makes people healthier, and so they get into their services earlier, and then it never becomes an extreme health problem. And I think that's just amazing. And
Mhm.
then a lot of people really like being able to cover their kids on their insurance until they're 26,
Yeah, because that's the
18.
other thing that people don't know is that it did provide provision for people who do have health
Yeah.
insurance already, private health insurance.
Yeah.
Because a lot of my friends, they were able to cover their kids while they were in
Yeah.
college. So it
Yeah.
did provide covering for them to be 26. Because before that, what was it, like 21? They had to be off their parent, or
Yeah.
23. They had
Yeah.
to be
So
off.
when kids are just getting out of college and they don't haven't found a job yet,
Yeah.
or they're just getting started in working, and they might have a part-time job. There's a lot of employers that don't provide health
No,
insurance,
they don't. No, they
or they,
don't.
they do everything they can to not be
Not
able
pay
to provide it.
attention.
But
Yeah, and the reason is because it's so expensive. I
it's
think
so
before,
expensive.
it's just like, oh my God, how much?
Yeah.
That's like that could be a huge part of a company's GNA or their fringe. The health insurance is
I
crazy.
I don't think it should have. I don't think it should have ever evolved to be part of employment. Like we should have a health. I believe we should have a healthcare system that's not dependent on, not employer based.
I agree with that. How did that? But then that gets into um, the reason why companies do that, because if they're able to do that, they don't have to pay more. It's just a negotiation tactic. That's what I'm thinking. As a
It
business owner
was
in my day
it,
job.
it was historically during a time when they were trying to incentivize, companies were trying to incentivize people to come and work for them.
Mhm.
And
That's
that's
exactly what
and
happened.
they
And now
started
it becomes
providing
like
health. Hmm.
health insurance.
Yeah,
And now it's like, honestly, it's the reason why some people don't leave companies and start
of
their own
course.
business because it's like, but I lose my health insurance. So it's
Yeah,
so Nikki.
it's extremely important.
When was
So
that? Let's just shift here and talk about health insurance in corporate environment. What time was that? How long ago? Just rough estimates. When was it that? Because I remember paying for my own health insurance, and I think I have Care First, and I pay like 100 and something dollars a month because I was an independent consultant. But then somehow or another, you had to go through your insurance. You had to go through your company and get insurance. When did that change happen?
well, that's what I was talking about. I forget when it was in history, but it was during a time like maybe right after one of the major wars, when companies were,
Mhm.
trying to incentivize workers to come, and started providing. So then they started providing health insurance as a way to incentivize them to come and work for them, and then it just evolved that way.
So is that called so what is the single payer system? How does that is that what the single payer system is?
No, well, we don't have a single payer system. I mean, that's what I think we should have personally. Um,
Mhm.
but it's just politically difficult to do.
Why
Um,
is that difficult? And I'm
I think
asking questions that
I
people are going
think
to be like, well, why is
again,
it
well,
difficult?
I think again, there's a lot of misinformation about it, and some politicians don't want the government to be involved in healthcare at all, and so they don't believe in healthcare as a right. I mean, I believe that it should be a right to have healthcare, and I think it would be more efficient. But anytime that it's discussed as a policy solution, then all the misinformation and disinformation comes out about a government takeover, and that it's going to be terrible. Um, I remember when it was under discussion, and the people came out of the woodwork saying, "Oh, it's a government takeover, and if I have cancer, I'm not going to be able to. I'm going to have to stand in a long line and won't get the best services." So it's just it's a value system, and
So
we're a pull your self up by your bootstraps um, culture.
what is the for people who don't know what is the single payer system?
Well, an example would be, Europe. Europe and Canada, they provide a single payer system, which just means that it is a government run health service, and so everybody is served. That
Mm,
that's all it is.
okay. And so my question to that would be, if we're already short 100,000, I did a project for the National Health Service Corps, and they recruit nurse practitioners, dentists, and physicians. Where in exchange for doing like working in a rural community or inner city where they have problems placing practitioners, they would pay for your college, they would pay for your nursing school, for dental school. You had to apply to get in the program. It's a federal program. I thought it was a great program.
Yeah, that
But
sounds cool.
yeah, but based on their statistics, I think we're short 100,000 physicians in this country. So if we don't have enough doctors, we don't have enough nurse practitioners, and we don't have enough dentists, how can we support? That's always been my pushback on
Yeah,
it. So, how can we support that when already we don't have enough? We don't
yeah,
have enough dentists. That's my own. I mean, I
yeah,
think that kids and seniors should be taken care of without a doubt. But how do we support that when we don't have enough health practitioners now, and
yeah,
we're not letting people in from other countries? Because there are physicians that I meet and they're driving Uber, Lyft, and driving
yeah,
taxis because they were physicians or health practitioners in their countries, but when they get to the U.S., they can't. I mean, literally, they can't practice. And so my thing was always like, why don't we have some kind of apprenticeship program for those health professionals where they can, even if you were a doctor there, may not necessarily be a doctor here, but you could be a RN, you could be a physician assistant. Like,
yeah,
why are, it's so, to me, I feel like it's just not focused on, our country has become a place, especially in healthcare, that's not really focused on solutions. We're more so focused on how do we drain everything we can out of the system and not
it's not very
helping.
it's not very efficient, is it?
It's
And
not efficient. And I just, and my attitude is kind of, sometimes I wonder, it's just full transparency here. Sometimes I wonder if we would be better served by people who are not career politicians solving the problems. I just don't think we have smart people or problem solvers. That's how I
that
feel.
that that
Or
that, that question is above my pay grade. But back to Medicaid and the cuts and the providers. There's a huge concern that the cuts of this magnitude will hurt hospitals, especially rural hospitals. One of the provisions in the new law makes it harder for it makes it harder for the states to raise the revenue to make their Medicaid match. And
really,
now, yeah, it takes away the flexibility for them to tax providers that actually helps to raise the money. So there's very big concerns about what are states going to do. It's a basically it's a cost shift to states, and now they're going to have to make up for these cuts in some way. And are they going to raise taxes, or are they going to take the funding from education to make up for this? Or are they going to cut providers? I mean, are they going to cut services or cut providers? And there's a big concern, not just about hospitals, but about nursing homes and other providers that take care of people who are aging and people with disabilities. We at the ARC are extremely concerned about the provider system, because it's already the infrastructure to provide services to people with disabilities and that are aging it's already fragile. We don't have enough direct support
yeah,
professionals, just like you were saying. Medical professionals and doctors. A lot of people that are providing this extremely important care don't get paid enough.
Yeah, I
And
have
so,
two
and so
friends
they
now.
go, like you said, then they go to be an Uber driver, or they go to work at McDonald's because they're paid more. And that's been in crisis for a while now. The crisis got worse during COVID, and now we're cutting Medicaid at a time when we really should be investing in Medicaid. And the problem with home and community-based services, that is caring for individuals in their home or in small in apartments or group homes, is that they are optional for states. They're not one of the
Mhm.
mandatory benefits in the Medicaid waiver. So, I mean, they're in Medicaid program. So people are entitled to institutional care if they meet that level of need, but they're not entitled to home and community-based services. So there's a big fear that these cuts to states, the cost shift, means that states are going to have to figure out how to make up for these cuts, and they might cut optional. They'll be forced to cut optional programs, including home and community-based services, and so there's fear that we will go backwards to institutional like settings, which are more expensive, and it's not where people want to live, and it certainly doesn't improve their quality of lives.
But it's a good business,
Yeah,
and that is where the money is. Okay, so now
it
I'm
costs
glad you
more
said
though.
that.
Yeah,
Yeah, but the person who owns the business will get more. See, we're this is about wealthy versus poor. And that's an opportunity to create long-term care institutions, facilities, and if you're getting 20 grand a bed and it's a state-run program, then the state gives you the funding and the funding goes to the businesses. So you just solve what's really going on here. That's what I'm thinking.
yeah,
Not you. I'm not putting words in your mouth, but that's really
yeah.
what it is.
We have a very long history of trying to get rid of the institutional model,
Yeah,
and
I
because
remember.
most because we I mean there needs to be a continuum, but most people want to live in their homes, not nursing homes.
Yeah, that's unfortunate. So what do
And
we
that's
do?
been a and that was traditionally been supported in a bipartisan manner. I mean, it was
Well, you
President
know,
Reagan. It was
Kim.
President Reagan that started the waiver system, so that you know it was called the Katie Beckett waiver at the time, because an Iowa child named Katie, her mom Julie wanted her. She had multiple disabilities, and she wanted her to live at home. And
Mhm.
it was President Reagan, under his budget reconciliation bill, that created the Medicaid waivers system, and then that expanded over years. And so we're very concerned about it going backwards.
Yeah. That's the only thing I can. And I'm always, I see things both from a business perspective and I see it from a social perspective. And I'm when I think about it, what I see happening, and I'm like, if you're a business person, this is the business proposition for every single thing that they're doing. The voucher program helps build private schools. You if you get kids on the track for private schools, whether they're poor or whether they're poor and smart, we want the poor smart kids so we can indoctrinate them and we can train them. If you are Medicare, we can get to create the institutions, we can consolidate everything, get all the poor people to work in the institutions. But it's just the system is changing. And my question is, what can we do? That's really what can we do and how do we do it to correct?
Well, we have to, here at the ARC, we have been working really hard to make sure that people with disabilities and families and the public understand what's happening, so that we're giving them all the information that we can, so that they can talk to their members of Congress. We had an extraordinary number of contacts, over 500,000 just since January on this related to the Medicaid cuts. 500,000 people contacted their members of Congress. I mean, that's what we can do is keep educating the members and making them listen and respond. They are our policymakers, and we need to make sure that they're walking in our shoes. Come visit my house. Come visit my center. Come visit this group home. Come visit the where my son and daughter work because of Medicaid supporting them. Same with the issue with education. I mean, you're right. It's the voucher, the big shift to vouchers in this reconciliation law very much concerns us because private schools do not have to follow, if they're not taking federal funds, they don't have to follow special education laws. And
I have a friend right now who he literally just called me an hour before. His daughter is on the spectrum. He was looking at, she's in a private school now. They say they don't have the resources, nor are they investing in the resources. And in charter schools as well, she was able to get in a charter school. They kicked her out because they said we don't have the resources. He lost his place in enrolling her because she's on the spectrum. She's verbal and she's mild on the spectrum. She has a speech therapy, a speech impediment as well, but they kicked her out because they don't have the resources. So it's happening.
Yeah,
already.
and public schools are required to provide all the supports and services that they need, and Medicaid helps to pay for that.
Really?
Yes, it's a large
Wow.
payer of school-based services to meet the IEP needs of students, providing physical therapy, speech and language, and even communication needs, even things that people need to communicate. And so we are extremely concerned about this shift because it's taking money away from public schools, and then they're not going to have the money to provide the services that are needed. And special education is already underfunded.
Yeah, especially with Department of Ed.
Yeah, and then there with the understaffed Department of Ed, that they especially did a reduction in force, especially in the Office of Civil Rights within the Department of Education.
Yeah.
And where will parents go if their special education rights are not being met if we don't have an Office of Civil Rights that's fully staffed?
Yeah, that's true.
Yeah.
I have several friends who work in the federal space. Not all of them lost their jobs. The ones who have technical specialties like engineering, tech, science, they all have their jobs. Public policy, information officers, all gone.
Yeah.
Department of Education, literally, colleagues, her entire staff was removed from the Department of Education. It's crazy.
So back to the original question about what can we do? We have to educate, and vote. We have to vote. We have to vote. We have to question people that are running for office. I really appreciate when there's educational panels of anybody who's running for any office, and sometimes we provide them with disability related questions. Do you support Medicaid? Do you support special education? And that's what we have to do. And we have to elect people. We have to elect good people that have the right values, and that value people with disabilities, and that want to support them so that they can meet their goals and be part of the community and be part of the economy. Why wouldn't we want people who want to work? Why wouldn't we want to help them to work? And why wouldn't we want them to be healthy so that they can be part of the community and be part of the economy? It's just beyond me.
Well, I would say that from my reading in the comments, I think the conservative mindset is that if people want to work, they would be working. That's the comment that I hear from around people who
Yeah,
we've had conservative people when we do our intake call. A lot of times, some things I don't even discuss on the podcast, but
yeah.
if they want to work, they will be working. That's the mindset. Like,
Well,
what's
what?
keeping them from working?
Yeah, it's hard to
What's
find.
keeping people from working, I guess.
It's hard to find a good job, and there's still a lot of discrimination for people with disabilities,
Hmm.
and they're discriminated against in the applications and in the job interviews, and not get if and often not given the supports that they need to be successful. But with supports, most people with disabilities who want to work can work, but they need supports.
Right. And that I think is, it's like, oh my God, that's too much work to do. It's like, oh, those women over there cackling, they need support. Oh, those black people over there, oh, those brown people, oh, those disabled people. We're all just doing great. And until we break that mindset, it's
Hmm. Yeah,
um us versus them. And us could not even be racial people. It could just be, I'm successful, I did it, worked through
yeah,
the odds. What
and that's the
but
same with
that's the
healthcare.
problem.
Yeah, and that's the same with healthcare. How are you supposed to work without your healthcare? Your health is important so that we
Right.
can be at work.
And mental health, what is that? Oh, we were all stressed out before. That's just something these millennials and these Gen Zs and Alpha generation, they needed mental health. What the hell? We worked hard before we did it. You know what I'm saying? So it's part of that is just cultural too. I think a lot of these people who are making these decisions are older. Let's say they're baby boomers and they have the power of the pen. And when you are Gen X and baby boomers, you are completely mental health. What is that? They don't get that. It's too softy
Yeah,
stuff. But when you say a nonverbal child who's autistic, who's brilliant, but still needs some support to figure out how to navigate in this world to contribute, that's different. So I think, and there's so many kids being diagnosed with autism now. It's
mhm.
unbelievable
Yeah. Well, we've gotten a lot better
at diagnosing.
at figuring out who needs supports. My brother-in-law, like as I mentioned, has autism, but
Mhm.
when he was born and most of his life, they didn't even know he had autism. It was yeah, he was diagnosed. Well, he was diagnosed with intellectual and developmental disabilities, but they didn't know about autism. They just didn't know about autism. Even 20 years ago, there was not a lot
Mhm.
known about autism. When he came to live with us, I remember scrambling, looking for books about autism. And now
Mhm.
there's a lot of books about autism, but there wasn't back then.
Yeah. So is
So
he,
we
does
just
he
we
work?
just
Is he
knew we
functioning?
just excuse me, sorry.
Does he work? Is he functioning?
Yeah, yeah, yeah. He does. He does recycling and lawn care. He loves to work, and he's very
See?
strong. He's a strong man, and all he
Wow.
and he just needs guidance. And once you put him to work, he keeps working until you tell him to do something else.
Oh, well,
Um,
that's
so
good.
he's a fantastic worker. hmm he does recycling, in the colder months, and lawn care during the summer months. And
That's amazing.
every time I ask him, I say, "Hey, Bill, how's work going? Do you like it? Like it?" He says, "Like
Oh,
it."
that's good. Bill's like, I don't need to say anything else. We use too many words anyway.
Yeah, yeah. Do you want to work or not work? Work.
Work.
He left. Yeah.
That's so
So
good. A friend of mine was
yeah.
saying how she was at a law. She works at a huge law firm. I think Patton and Boggs out of DC, and she was sharing how like all they had a disability month, and she said, "Oh my gosh," she's like, there were so many attorneys who were on the spectrum on that call, people you would never know. I said, "Are you serious?" She was like, "It's tons of people here that are autistic, but they just have learned how to, there are different versions of
Accommodate.
on the spectrum. And she
Mhm.
said they were talking about different ways they cope. And so we talking about that for a personal reason for me. And I was like, oh my God, but I think people just don't know. Like you were saying,
Yeah.
what the expansion group means. That means people are disabled. That means pregnant women. That means old. Like people are like, oh, the lack of education. And I think that's intentional though. You just think Medicare, Medicaid, lazy people. No, that's not what it
It's a
is. It's
myth.
correct.
That's a
That's
myth.
the
I think we need to reframe that.
Mhm.
Medicaid is so important. It's not just healthcare. Healthcare is extremely important, especially if you have complex health needs. Traditional private insurance often doesn't cover the complex health needs that of kids and adults with disabilities. And then it's the largest payer for long-term services and supports. So for Bill, that means everything. It's essential for helping him to be have the supports he needs to be part of the community and get to work, helping to make meals. It is it is the lifeline for Bill. He would otherwise be housed in an institution, not doing anything, and I can't imagine that because Bill is so full of life and so happy, and he makes other people happy when
Right.
Bill's around, it's hard not to smile and laugh, and he does funny things. And I have two kids, and they grew up with Uncle Bill,
Oh,
and they love him because Bill, you want to play football? Yes, he says esque. They call him Uncle Esque sometimes because he'll do anything you want. Do you want to play baseball? Esque. And so they had a playmate
right.
that would do anything they wanted.
Gives you a break, right?
Yeah.
You're like, go with Uncle Bill. Oh my
Yeah.
God.
Yeah.
That's so
So
good.
Medicaid is literally his lifeline.
Wow. And so let's talk about the role of Medicaid in pregnancies, because that is the piece. Because people are still having babies. How
People
does
don't
that
know that I think it's almost 40% of babies are born because of Medicaid. Medicaid pays for. Yeah, yeah. Uh, well, yep. A lot of people don't know that.
so what will happen if that goes away? What does that
Yeah,
look
I'm
like?
scared to. I'm scared to even.
Oh my God. I just
Even.
thought about what I said. Because if they don't have Medicare, oh my God, we're talking
I
about
mean,
instant
hospitals still
mortality.
have to provide care, right? So,
They do?
yeah, hospitals have to provide care. So then it's called uncompensated care, and that has to come from somewhere. So so these cuts are going to impact you and me, even though we have health insurance right now. The costs are going to go up for us
Mhm.
because hospitals are going to have to pay for uncompensated care, and that's going to have a ripple effect on the whole healthcare system. I've heard that premiums are going up already in response.
I pay a lot of money for health insurance. I have like the PPO, because there's certain things like I'll eat oodles and noodles, but I will not skip on health insurance because I know how what can happen where and then sometimes you think like that's not paid for as much as I pay, and it's not paid for. So I believe it. I believe it. It's
And
crazy. So oh my God, do they say how big the
yeah.
premiums are going to go up?
No, I just saw, in the news that they're considering raising their premiums, but I don't know how much.
Oh, oh
So
my
we're
goodness.
we're
So
all we're all going to be impacted by this.
when will we start seeing the impacts of this big, beautiful bill?
Yeah, that's a good question because some of it won't is not until later, like after the midterms.
Doesn't
There's
know.
n- new for the first time ever. There's new work requirements for
What?
yeah, work requirements for people that are in the Medicaid, the expansion population. they're now going to have to document that they're either working or volunteering or going to school or community service in order to keep their Medicaid, which is just doesn't help people get to work. It just is a paperwork burden. So that starts in 2027, again, right after the midterm.
Right.
And yeah, it's technically it's supposed to exempt people with disabilities,
Okay.
um, people with intellectual and developmental disabilities, but again, you're going to have to do paperwork to prove that you have this exemption, and all the definitions are very unclear. And we've seen in the past that it doesn't work. In like, for example, when Arkansas tried work requirements in, I think it was 2018, they immediately hundreds of people were disqualified for Medicaid, not because they weren't eligible. It
Right. That's
was just, maybe not have access to the internet, or it was just paperwork burden. And I'm really concerned about people in rural areas that might not even get the information that these new work requirements are in place. Some people said that they didn't even know that they were dropped from Medicaid until they went to get their medications, and they found out that they no longer had insurance, and then they have to reapply. And this is called
oh, wow.
churn, and
Churn.
it's expensive. It costs a lot of money to administer work requirements. And so, in that article I was telling you this about that I saw in the Washington Post this morning, North Carolina officials were saying, we're already burdened by, too many. We don't have enough for administrative expenses now. This is going to be even more expensive.
Mhm.
And there'll be millions going to administration and setting up this infrastructure instead of helping people get their insurance, their coverage, helping them with their health so that they can go to work. It's just, you know, it's just a way to get people to no longer have Medicaid. And then they call it savings.
Savings.
Yeah.
So what is the concern with the work requirement?
That it's just that,
College, volunteering, so you don't have to have a job, but if you're volunteering somewhere, like
yeah.
you're
So
doing
there's a myth that there are these 23 and 26-year-old, usually they say males, sitting on the couch refusing to work, so that
because they
they
don't make enough
so that
money.
they can get Medicaid. They make it sound like it's a welfare program. It's healthcare. It's helping people be healthy so that they can participate in the community, participate in work. So it's a myth that there's these able-bodied people refusing to work, and that's just a myth. Most people on Medicaid are already working, or looking for work, or wanting to work, and just or don't have an employer that provides health insurance, or they're do seasonal kind of work, or gig workers of some sort, or they have chronic conditions or multiple chronic conditions, and wish they were working, but so it's just a myth that I think people should understand.
Okay. So there's a video trending now. This woman, she was going off on Sarah Huckabee, retired chemist, like brilliant woman. She now lives and works in rural Arkansas, and she's over Sarah Huckabee. But she's saying like they don't have proper internet service, and the roads are trash, and she's giving life to what you're saying. What would you say needs to happen now at the state level? Because now it's pretty much done at the federal level.
Yeah.
But what do you think needs to happen at the state level?
Yeah, I mean, many states are going to be impacted by this new law, and they're already. I think they're Well, first, a lot of states are waking up and going, "Oh my God, I can't
They're
believe this
now
is
feeling
coming."
it.
They're now looking at it and going, "Oh my gosh, we're going to have to, reconvene a special session to figure out our budget because their budgets are already tight. They don't want to raise taxes, so they're going to have to rejigger things. So what has to happen? Is a really good question. They're going to have to look at their budgets and figure out how to make up for these cuts. And what we're trying to do is, we're going to be monitoring what's going on at the states. Our chapters will be monitoring what's going on and then reporting to us so that we can, at the federal level, educate members of Congress about the impacts that this is going to have.
Hmm.
But yeah, I think they're just state agencies and state legislators are just getting the information now, and I think some of them are in denial, and some of them are trying to figure out how to what they're going to do, and likely they're going to have to cut eligibility, cut services, or cut the amount that they pay providers.
Hmm. So, quick question for you. How does it impact the immigration issue? Because I know that's a big blow up in on social. What's trending is people have been a little bit concerned that people, the undocumented, are getting the help, support, and help from Medicaid and Medicare, and they're not, as a U.S. citizen, able to get
Yeah.
some of the services. How does that play out? What's the myth and what's factual about that?
Yeah, well, the undocumented individuals are already not eligible for Medicaid or Medicare.
So they do not get it.
They already don't get it.
Okay,
So
thank
the cuts that they made, there are a lot of little areas where they're trying to take away any public benefits to immigrants, which I feel is very sad, um, and unwarranted, and also not smart policy, because again, it's just like taking away taking away services to children and adults that need it. They're trying to work, they're trying to become citizens, and it's very hard because we really need immigration reform to make the pathway, the legal pathway, easier. We make it so difficult for immigrants. It's and I feel very sad about that. And in terms of the workforce, at least 25% of people who are providing the direct support for taking care of our elderly and people with disabilities are immigrants.
Mm.
And many of them also need health care. So I feel I'm very concerned about that we're going to lose, the direct support crisis is going to deepen.
Yeah, that is a huge issue. I did not know that they did not get Medicaid and Medicare. I thought they did get Medicaid and Medicare. So I think that's a big myth buster.
So they knew that these provisions weren't even going to have a huge savings because they undocumented individuals already were not eligible. Um,
So
so
how do they get support at all? Do they get support, or they
well,
just go to the hospital?
I'm not, again, not an expert in immigration reform, or the immigration issues, but if you have a green card or you're here legally, then and if states want to provide health care, then they can.
Okay.
So some states are providing health care using their own dollars, and
That
they
explains.
even
Okay.
want to take that away or disincentivize states
Uh-huh.
from even using their own dollars to provide health care for immigrants that are here legally.
Illegally or
No,
legally?
legally.
Legally. Oh my God. So ones that are here legally as well?
I'm the yeah, they're yeah,
Ah, so much, Kim.
and
How do you
they're I mean, immigrants are humans.
they don't see it that way.
I know.
I mean, it's just, I have learned and I have observed that in order to really wrap my head around it, because to me, the one thing that's the big, I mean, I understand healthcare. To me, that's basic, that children, you can't choose whether or not you get cancer. So it's just unconscionable that kids do not get cancer treatment, and they gutted the cancer research programs and initiatives out of this budget. To me, that was just like, oh, like you got to be kidding. Education, the same thing. You say you don't have a strong workforce. You say you want to be able to compete
Mhm.
with the great countries or these other countries, but you're gutting healthcare. I mean, education. You don't have good education. People who in high net worth neighborhoods have education, because education usually comes from property taxes. And so the more expensive, the more income they can get out of the high earners, the better the school system. But there are brilliant kids who are born into poverty. So these kids, if you make education equitable, we would literally be able to get rid of the national debt. I did research on it. If you could pay every teacher 100K and make it highly competitive, then literally in 20 years we would be out of the national debt issue that we have, just by upgrading the teacher salary, hiring better quality teachers, training them, and giving every kid access to a quality education. Done. Superpower in the world, brilliant. They won't do it because the system is set up to keep people poor and rich, smart, ignorant. And when you can do that, you can really control a population. So this isn't really about what they want to do for people who are like you and I, who like, this is a no-brainer. If you're thinking from their mindset, I mean, not even talking about
Mhm.
Democrat and Republicans, but from the mindset of people who are uber rich, you need to have a group of people subjected. And so that's what this is about. And so the question is, what are the other public members going to do, ourselves included, to bring change? And that's where we sit with it, to kind of have a complete disruption and a complete shift. Because we don't have the wrong Ronald Reagan Republicans anymore, the John McCain's anymore, the John Huntsman anymore. We have a whole new set of people, and their mindset is completely different than normal people. It's something out of this world. So, with that, thank you so much, Kim. Don't be, I mean, it's going to happen because I firmly in my heart know and believe that in 2 or 3 years, when these changes hit, nobody is going to really, it's not happening.
Well,
So,
we here at the ARC are gonna work as hard as we can to try to reverse these cuts. And there's already a bill in the Senate to reverse all the healthcare cuts that were in this reconciliation law. And
yes.
so,
What do you think? Who do you think is an advocate just from a congressional or Senate? Like, who would you say is someone who kind of has it? Governor, senator, congressperson who you think really gets it and is an ally in your area?
we actually have a lot of allies on the Hill.
Okay.
So I think that we'll be able to convince a number of bipartisan members of Congress to reverse some of these cuts, um, and so I'm going to remain hopeful that we can um, get bipartisan support for this bill. I'm going to do everything that I can to try to reverse these cuts, and meanwhile, we're going to do everything that we can to try to mitigate the impact at the state level.
That's, I think the governors are definitely fighting back. And I think people are holding politicians accountable, which is what we want. I started All Americanish just to educate people. to let them know what's really going on. I think in 2027 is going to be the reckoning, if not before then, because people will start to get notices, I'm sure. And then the more people start noticing, the more people start sharing information, then I think that's when people are going to be like, what? Are you kidding me?
Mhm.
Because it hasn't really hit yet. They're not feeling it yet, but they will soon. So thank you so much, Kim. I
Thank
appreciate you so
you.
much. Continue in the fight. I'm glad you're fighting for us, for all of us, and have a wonderful vacation.
Thank you so much, Towan. Thank you for having me.
You too. Bye bye.
Bye bye.